She was like, Akitunde, I'll say this in Yoruba, it's not be sweet in English. She said, Akitunde Tori Olorun, ọdún mélòó ló ti lò nínú medicine tó ti ní HIV. I just opened the tap and I kept on squeezing the blood. What explanation do I give? How much have I earned from medicine? This is getting my second year of practice. I was thrown aboard, lost in what it could mean to, for the first time in my life, not just read or hear or talk about HIV, but to be experiencing it for the first time.
It was a beautiful thing to see that there are senior colleagues who don't just care about you getting the job done, but about your well-being as a healthcare worker, a fellow healthcare worker.
For the first time, I felt the impact of what it means to be stigmatized. So people shouldn't stigmatize because this person has HIV. I shouldn't touch him. We shouldn't share plates. We can't shake. We can't hug. We can't even, those basic things. HIV is no longer a death sentence. And I was surprised that the patient actually thought HIV was just like
malaria.
Was just like malaria. The patient just asked me that, hope there's drug that I will take and I will use and I'll be fine.
In the course of performing your duties, you also want to preserve the sense of dignity for that person. So the person doesn't feel like, oh, okay, because it seems like I have maybe symptoms suggestive of an infection, I am now, a threat to your life and all of that.
What do you think becomes the priority if we're trying to rescue a patient in an emergency situation and then a doctor becomes a patient in the process?
So in that case, the doctor who becomes the patient has to be the priority, because if a doctor that is alive that will be able to treat the rest of the other patients. So in that particular case, the priority has to shift.
And finds out that whoever they had whatever with is positive. What should be their next point of action?
Okay, so first of all, the first point of action or the first line of action, calm down.